Hey, welcome back to another bi-monthly educational video on getting same-day relief with patients who present with back pain with or without sciatica, but definitely have a positive straight leg test. It's important to understand what I'm introducing is only one segment of an ongoing treatment plan that might include therapeutic exercise, ultrasound with or without trigger points, decompression, or whatever procedure you might presently be using. The bottom line is this blocking procedure can be used to complement your present treatment protocol. Now, one area you need to be able to differentiate is with the straight leg test is indicating if it's a disc derangement or if it's an indication of a sacroiliac dysfunction. The first 20 to 30 degrees when you're lifting a straight leg test, if it begins to produce pain and then dissipates, is an indication of a SI dysfunction. In the situation, I strongly recommend treating the SI first. Remember, it doesn't have to be one or the other. A patient could be dealing with both issues. Now, if the patient has a classic positive straight leg test where the back pain continues to increase as you elevate the leg, the use of the SOT block should help dramatically in the patient's recovery, and the patient will realize that something improves right away. Many disc disorders are a result of prolonged pelvic and lumbar flexion. When we consider the amount of time people sit at home, at work, drive, watch TV, it becomes quite obvious how much time the pelvis is put into a flexion position where it rotates posterior. Many have tight hamstrings, which is a byproduct of prolonged sitting. Tight hamstrings pull on the ischium, reinforcing the pelvic flexion. Now, although the end product of stretching a hamstring in the supine position is to increase pelvic extension, at the same time of doing the stretch, the pelvis is temporarily put into an increased flexion, which is why the patients, when you do a straight leg test, will experience an increase in the low back or leg pain. By placing the SOT blocks on the crest of the ilium, you'll get the stretch in the hamstring without the temporary increase in the flexion of the pelvis. In fact, I make sure the patient is aware of at one point they begin to experience pain in the low back or the leg during the initial test. I then put the blocks in position, stretch the hamstring again. In about 80% of the cases, they will be able to experience the hamstring stretch without feeling any back pain. If the change is dramatic to the patient, it's a great time to tell the patient that you expect or you consider that they're having a disc herniation and that an MRI might be a good idea. Once the stretch is complete, I remove the blocks and recheck the straight leg raise and ask the patient if the back feels better than it did at the first time we first tested it. Very simple procedure, and it gets the patient to see the light of hope right away. So at this time, we're going to actually bring a patient in. We're going to go through the procedure, just give you an idea of how to incorporate it into your practice. Okay, so now we have Chris here. I think we used Chris on a stenosis educational video, but he's back to demonstrate how we incorporate blocks with a patient that has a disc indication and has a positive straight leg raise. Now remember, as I said, without the blocks, if somebody says, oh, it hurts right there, and then all of a sudden starts to feel better, be aware that you might have an SI component. On the other hand, if they start to go, the higher they're going, the more and more the back hurts, it's a good indication that you do have a dysfunction. What I like for patients to do is let me know, okay, tell me when you start to feel back pain, and they go, oh, right there. And so we give them an idea of how much improvement there is. Again, what happens in a situation like that, you're stretching the hamstrings, and here are people that have tons of tight hamstrings. The hamstring attaches here, and as you're pulling, you're bringing the pelvis more and more into flexion, which would aggravate a disc herniation. Again, this is the extension type of patient and not the stenotic type. So the hamstring, by pulling on here, causes a posterior rotation of the crest, which would aggravate the condition. Now, What we want though is a stretched hamstring, but we don't want to be irritating the nerve or the disc while we're stretching the hamstring. The solution in about 80% of the cases is use blocks. The blocks go up on the crest. Get the crest, you want half the block on the crest and about half off the crest. Now in a case like this, I'm going to be saying, Chris, remember at about 80% when we had your leg up to about here, you felt some back pain. Let me know if it feels better. So in about 80% of the cases, you're going to get this leg up here and we're going to stretch it and they're going to say, hey, what do you feel? Well, I just feel stretching my leg. I don't have any back pain. That's a good indication. That's what you're looking for. That would be ideal. We let them know that, hey, that's a good indication. You know, the fact that you feel better when we put the blocks in is a strong possibility that you have a disc herniation. Okay, and the key thing is what we want them to see is that when we take the blocks out and we redo this, they feel better. And that's really good to them. They're happy to see that. A lot of these patients are pretty desperate. They've been, once you start incorporating a center that specializes in the treatment of low back pain, you're going to be attracting more and more of these tough cases. This simple blocking procedure has made major changes in patients right after the very first visit. So we're going to hold the stretch as long as it's not producing back pain. Okay, we'll hold this. And it can be anywhere from 10, 20, 30 seconds. After that, we'll go to this side. We'll do it again. Again, afterwards, you can do 2 cycles, 3 cycles of this. Okay, we take the blocks out, and I would say, Chris, remember how it hurt originally before we put the blocks in? Tell me if it's, I use the 4th thing. Tell me if it's better, worse, the same, or different, okay? And I also tell them, hey, you're not gonna hurt my feelings if it's worse or whatever. So we get them back up to here, and about 80% of the time, the patient's gonna say, hey, doc, it feels better. Well, I said, well, that's a good sign. I'm glad about that. It definitely is a strong indication that you do have a disc herniation. What I'd like to do is, let's get some relief, but we're going to need to consider looking at a possibility of an MRI to see the degree of herniation. I do use that Kennedy model to show the disc. It's a great model. I think you suggest you pick one up. It's a disc that actually shows the gel coming out. Now, remember that this is just one little tool you need to incorporate into your practice. I would not, again, I'm not telling you whether to do it. I personally would not manipulate a disc disorder like this. I would have them do prone press-ups. I may do some additional stretching. I may put them on repex. I may put them on decompression. I may throw an ice pack on them and have them walk on the treadmill. I'd give them a home exercise program. I would, at this point in time, when they start to see some improvement, I'm going to start my education and get them to realize there's more to care than just relief. We got to talk about stabilization, we got to talk about correction, and we have to go long-term support care. I let them know if I'm right, and the ultimate proof is whether the radiologist sends a report back stating that you have a herniated disc, that if I'm right, it takes a full year for a disc to heal. It doesn't mean you have to come in here every day for a full year, but once we get the condition stabilized, some type of support program of either, and by the way, stabilization, correction, I tell them it could take 1, 2, 3, even 4 months depending on the degree of severity. So once the condition stabilized, I do recommend patients come in once a month and keep things under control. It's a great time now that they understand if you want to incorporate more of a chiropractic, the philosophy as far as health and wellness. It's a great time. The patient's now happy. They're starting to see results. They see a change in what you've done with them in the first few visits. That's the time to make the education in the patient. So if you have any questions, bring them in and we can put them in or add them to a future educational video. So I'll see you at our next workshop. Take care.